and welcome to Health Plus. Treating a child is not like treating a miniature adult. Newborns are particularly vulnerable, and children are vulnerable to malnutrition and infectious diseases, many of which can be effectively prevented or treated. Today's edition in Health Plus, we are dealing with pediatrics. To know more about pediatric health issues today, we have with us Dr. Narayanan, who is a consultant pediatrician for the past 15 years. Welcome to the show, Doctor. We would like to know more about the role of a pediatrician.
As you have said, pediatrics is a specialty in medicine that deals with children. Children includes from the day one a baby is born. Then that day is called newborn.
Right.
Then he becomes an infant till 1 year of age. Then a toddler, a school-going child, then a teenager. So from day one of life to maybe 18 years of life, this sect of population is looked after by pediatrician.
Now, these vaccinations that have been given to infants or children, basically, is there any risk for the vaccinations?
Vaccination, the golden rule in any branch of medicine is prevention is better than cure.
Right.
So vaccinology that deals with the vaccines, that's an evolving field that has been there for the last maybe 2 centuries. It has been there. It all started with the cowpox vaccination. Then later, we all know, maybe about 4 decades back, smallpox, which was a major killer before that era. It was eradicated from this globe just with the help of vaccination. So, learning from this success, more and more diseases are covered under vaccination. So, so it's the best health intervention a country can have to prevent diseases.
And why are these pediatric dental problems so high nowadays?
It's a fact because the children have the milk tooth till the age of maybe 5 years. They'll be having the milk tooth. By the age of 2.5 years, all the milk tooth, that will be about 20, that will be 20 in number. By 2.5 years, its eruption is complete. So, this, this set of teeth, it can be easily damaged by poor dental hygiene. One important factor that is causing this poor dental hygiene is overconsumption of sweet items. What happens is when the child is taking some sweet item, there will be some particle of the sweet that is sticking over the teeth. So a particular bacteria comes there, settles there. It has got some reaction with the sweet sugar portion. Then that there is a product formed that will erode the teeth. The strongest part of the teeth is the enamel. Once it is eroded, the tooth is not, it is unsafe, and it will be easily approached by the bacteria, and other infections will be there. So we call it a caries tooth. Another thing is what you call the baby bottle syndrome. There are a few, maybe a very small percentage of children who continue to have this bottle feeding beyond maybe 2 years and like that. That is also harmful to the teeth. And another thing is that if the brushing should be practiced early in life, if it is not proper, then also there will be damage to the teeth.
So, doctor, how would the parents be aware if there is a problem with the growth of the child?
Yeah, in pediatrics, growth is a terminology that includes both the growth in the length or height, then increase in weight of the child. So from the day one of life itself, the neonatologist or the pediatrician will be recording the length of the baby, then the weight of the child, then also the head circumference. That is the circumference of the head. That will give a rough estimate of the size of the brain. Okay. So these three parameters from the day one of life, the pediatrician will know. Then it's a duty of the pediatrician to record the increase in length and weight when they come for periodic review. During the first year of life, usually this is done when they report for immunization or any other health checkup. So by 1 year, we will be knowing what is the expected weight of the child, expected length of the child, if the child is maintaining that length and weight.
Okay. And what special care should be taken while feeding a baby?
Yeah, feeding a baby is an important aspect in pediatric care. And we have already told that the baby should be absolutely breastfed during the first 6 months, should be entirely on breastfeeds.
Okay.
Then till 2 years of age, the mother has to continue feeding the baby from the breast, and in addition add some other semi-solid items or household food that is prepared. Mother can substitute. That's the way we feed a normal baby. So that means first 6 months exclusive breastfeeding, then continue breastfeeding till 2 years of age. There may be some as I have told now in the newborns, preterm babies and all, sometimes if you are not able to suck properly, if they are not able to express milk from the mother's breast, in that case we give bottle feeding, formula feeding. That must be done only if the doctor is advising. And bottle feeding has got all the problems of, one is that there is increased chance of infection. Sometimes the feeding may not be adequate. Sometimes there may be increased gaseous distension and other crying and other problems for the baby.
So doctor, what are some of the disorders that occur while feeding a baby?
One thing is that if the baby is not properly held in mother's lap and if not properly positioned, it will be difficult for the baby to suck the nipple. Then it will be both painful to the mother and the baby will not be getting enough milk. Okay. So that proper position should be kept. The baby should be kept as close to the mother's body as possible. Okay. So that's the first thing that mother should be careful about. Then in little more older babies, we should not try feeding a baby while the baby is crying or laughing like that. Okay. Then there is chance of the food material getting in the windpipe, aspirated into the windpipe. That problem it occurs may not be that frequently, but once it is there, no, it's a real problem. Okay. And even for toddlers and all, they should not be permitted to take food while laughing and playing and like that.
Constipation is very common in young children. Any remedy for that?
There are so many reasons for constipation. The main one being faulty food habits in the child. Mainly child not taking sufficient quantity of fiber containing food in the diet. Vegetables and such things. The second one is maybe very rare situations, there may be some structural abnormalities in the large intestine that can lead to constipation.
Okay. So do you think a proper diet would help this?
Definitely. That's a cornerstone in the management.
Okay. All right, thank you for your time on our show. That is Dr. Narayanan speaking to us exclusively regarding pediatric health issues.